Welcome to MEDIMAGZA, the podcast, of course, your trusted source for expert-driven health and wellness insights. Today, we're thrilled to host Dr. Saisha Naransammy, a dedicated chiropractor based in Fairland, Randburg. Now, Dr. Naransammy holds a master's degree in chiropractic from the University of Johannesburg, where she was recognized for academic excellence as a member of the Golden Key International Honor Society. With the experience tutoring at UJ's chiropractic clinic, she brings a holistic, evidence-based approach to patient care, helping everyone from athletes to infants. She's also the author of our December feature, Common Musculoskeletal Issues During the Festive Season. Today, she'll be sharing practical advice on how to stay pain-free and mobile during the holidays. Let's get started. Welcome to the show, Doc.
Thank you so much, Clive. Thank you so much for giving me this opportunity. I'm so excited to be discussing these issues because the festive season is such a joyful time, but it can also be surprisingly tough on one's body.
It really, really can. And I'm so glad that we have you here today because there's a lot of ironing out that we need to do. Firstly, how was chiropractic founded?
Chiropractic was founded in the year 1895 by an individual called Daniel David Farmer. So he was the founder of chiropractic, and he performed the first spinal adjustment in Davenport, Iowa, in the United States. And he believed that spinal alignment affected the nervous system and overall health. And that's what's developed today is the modern day practice that we know.
That is incredible. It was founded so far back in the day, and it's still such a big practice today. What inspired you to write about musculoskeletal issues during the festive season?
So with that topic, I felt it was very important to give individuals practical approaches to avoid unnecessary pain. We tend to stress more during this time, sleep less, there's deadlines, there's entertaining guests, there's getting ready for the holidays, and then we tend to neglect our bodies in the same go. So I thought it would be beneficial.
Really, really wonderful topic. I myself even learned a few things from this, so thank you so much for that. Which type of pain or injuries do you commonly see in your practice around this time of year?
So I see neck pain, shoulder pain, especially like upper back pain from prolonged standing, for example, cooking or wrapping gifts, general muscle tightness, and sciatica flare-ups. With that being said, many people do renovations or maintenance during this time. So there's lots of bending and twisting movements.
What are the main lifestyle changes during the holiday that can contribute to these issues?
So I would definitely say the not being in routine. So exercising less, sleeping less, traveling. So I mean, it's not going to be your bed at home or your pillow that you're using. So that could also exacerbate pre-existing symptoms, incorrect footwear, like being rushed. I would say being rushed is like a number one key factor in this.
Yeah. No, I completely agree with you because I think around this year, and because it is such a busy year for a lot of people, nobody really plans in advance. So going away is a last minute thing, and it's like let's just get everything packed and leave, and then having to adjust to a new bed, and you maybe forgot comfy shoes, and it's all of those little things. Can you explain how cold weather now specifically impacts our muscles and joints?
Okay, so why I added that on is because the weather has been very unpredictable recently. I mean, we've been experiencing rainfall and it's also a bit chilly. So the cold weather affects muscles by basically reducing the blood flow to the muscles. And that causes muscles to stiffen or tighten and it aggravates the various joints in the body.
Mm. That's so true as well. Because I mean, I normally train in the mornings, but I've switched it up to the evenings, and I noticed I've got more energy and mobility by being flexible for most of the day and then doing my sessions in the evening. So that's actually so true. You mentioned rather stress and fatigue as triggers. How does emotional tension physically affect our bodies, Doc?
So, with emotional tension, we activate our sympathetic nervous system, and our sympathetic nervous system is responsible for fight, flight, and fright mode. And that causes muscles to tighten, especially in the neck and in the shoulders. It also causes our breathing to be shallow and our posture to collapse. So, when people say, oh, I carry my stress in my shoulders, I think that is very true. And it also makes one sensitive to pain, because when I do my history taking, I ask patients, are you under stress? And they'd be like, yes. So that would also be one of the contributing factors.
Very, very interesting. What are some common mistakes people make now when lifting gifts, decorating, or even luggage?
So rounding the shoulders, not hinging at the hips, and not keeping the hips and knees level. So basically, you need to keep a straight back and bend the knees to pick up anything off the ground. It's very important because we don't want anyone to have a slip disc or herniated disc. And as well as shoulders, carrying things awkwardly, not distributing the weight evenly with the shoulders, reaching overhead, um, and so forth. So those are the mistakes
Yeah.
that people make.
Absolutely. The next one's really, really important because I know my mom complains about it a lot because we're based in Northern Cape and she's in KwaZulu-Natal. Many people, of course, travel long distances to see families during the holidays. What are your top posture
Yes.
tips for travelers?
So I would say lumbar support is very important, especially if you're flying or traveling by car or bus. Especially if you've got like for your mom, I'm sure she's in her senior years now. So like osteoarthritis or degenerative joint or disc disease. So it's important to take a towel or a lumbar support cushion or even a jacket. You can roll it up and you can place it here in the vicinity of the lower back to keep a straight spine. Keeping the phone at eye level, so not leaning down like this, as that aggravates the neck and shoulders. And also keeping hips and knees at level, so not wide feet apart, basically all in the same plane. And also taking breaks in between, stretching, doing some stretches for like 30 seconds, taking
Mm,
breaks at least every 45 minutes to 60 minutes, and distributing, if you're carrying like 4 bags, for example, or 4 packets, let's say, of groceries, you could rather do 2 packets in one hand and 2 packets in another hand. So you're distributing that weight evenly on the shoulders and the spine.
that is really, really useful tips, and I'm definitely going to make notes of that. Can you walk us through a simple stretching routine listeners can use while traveling or at home?
Yes, so essentially a stretch needs to be held down or held in that position for about 30 seconds. If there is pain, now if a patient comes to me and let's say it's like a day or two that has passed, I'll be like, start with 20 seconds and then we ease into it for 30 seconds. So I'm going to demonstrate what I can demonstrate in this position. The rest I will explain. Okay, so stretching the neck. So placing the one hand on the opposite side of the head, holding that down for 30 seconds. Okay, and then you can do a bit of rotation, looking like under the armpit, because that's stretching a different muscle, 30 seconds. And then you always come back to the center to neutral and you repeat on the opposite side.
Nice.
And also rolling the shoulders forwards and back. That's like just a quick one if you like, sitting and traveling.
Yeah.
Opening the chest, so keeping the arms wide, so to open up that rib cage. And also a seated hamstring stretch, where you just hold straighten the leg, and also ankle circles and calf raise. So this can be done in like 5 minutes, basically anyway, even if you're sitting at the salon getting your nails done, or
Mm.
at the airport waiting, or at the bus terminal, and so forth. So it's very quick and easy stretches
Yeah.
to do.
It seems very uncomplicated for a lot of long-term benefits. So that's a good one. Doc, I mean, it is summer right now, and like you say, the temperature fluctuates a lot of the time, and we're covering something on hydration at the moment. Why do you now highlight the importance of hydration and micro breaks? Why are these small habits so effective?
So hydration keeps the muscles flexible, and ideally we do want flexible muscles
Mm,
for increased movement. And the micro breaks prevents muscle strain from accumulating, because the body can only take so much, and then when it's reached its threshold, then patients will be like, "Oh, I feel like I locked my neck or my back is locked." So we try and prevent that.
I've heard people say that, so that's actually very important. For those who have to
Yes.
cook and stand for long periods, especially during festive season, what practical adjustments can they make to kind of reduce that strain?
So number one would be supportive footwear. So not flip-flops and very flat shoes. I would even like suggest Crocs or a shoe with a thicker sole for shock absorption to the feet. Supportive mats so you don't end up slipping as well. And keeping the items that you're using, the frequent items you're using, so you're keeping it at basically waist level instead of reaching overhead and so forth. And taking stretch breaks in between. And, if you're following a recipe, don't look down, rather have like a stand for your phone or your iPad or your tablet so you can follow instead of you like straining the neck. So those would be my tips. And also taking some vitamins as well, because with stress and deadlines, magnesium does tend to deplete. So I would also suggest a good magnesium supplement.
Yeah, I can definitely tell you the phone on stand works. Usually, when I also prepare food, I'd like to or tend to put it onto the microwave onto a stand, so it's very eye level, and it avoids that strain of looking forward the whole time. What are some of the red flags or signals someone should seek professional help instead of self-managing their pain?
Okay, so numbness, tingling, and weakness, that is a red flag. So that needs to be, the individual needs to consult with a medical professional, as well as pain that doesn't resolve after a traumatic event, such as a motor vehicle accident or a fall or a sprain. And changes in bladder and bowel movement. That one is actually a very big red flag, as that is a medical emergency, can lead to paralysis. So that's important. Oh, and severe headaches, sorry, accompanied with slurred speech, double vision, and dizziness. That also needs to be checked out.
There is quite a lot that you mentioned because if one thinks, oh, I've got a ache and pain, no one really looks at bowel movements or anything of that nature. So thank you for mentioning that. If someone tweaks their back or neck, what's the safest immediate response?
So stop activity immediately. I would also suggest placing an ice pack. Why most people do go to heat. I think all humans say, oh, we want to use the bean bag or the hot water bottle, but that actually aggravates acute pain. So the ice pack decreases pain, inflammation, and swelling. So that is very good in that acute phase. And then I would also tell the individual or patient not to do any heavy lifting or twisting movements. Rest in between and basically those are the tips and resume activity once pain has subsided. But if it hasn't and if they can't get to a GP or chiropractor or physiotherapist, then I would suggest Panado, the over-the-counter medication, and anti-inflammatory such as Norplex, because you don't need a script for that.
Yeah, that's really good advice right there. Are there any misconceptions about back or neck pain that you wish more people understood?
So I think individuals or patients think that pain means damage, and it does. That's not the case actually. And they would say rest all day, but that's actually detrimental because it prolongs the recovery.
Mm.
And posture must be measured. It shouldn't because healthy posture is dynamic and it changes throughout the day. So rest in between, have a balance, but don't overexert.
I love that. I love
And
that.
don't Google.
Dr. Google's not our friend, allegedly.
It stresses a patient out. I mean, I do have patients that come in, and if it's lower back pain, doc, is it my kidneys? And if it's mid back pain, doc, is it my lungs? I'm like, no, no, don't worry, you're okay.
Wow, worst case scenario first. Doc, how can families and
Human
healthcare
beings.
workers plan ahead to minimize physical strain during the festive rush?
So if it's like preparation of dishes, foods, it needs to be assigned accordingly. If it's a venue, check all of those things. If the venue doesn't, if it falls through, then there must be a plan B. So basically, prepping ahead of time, using wheeled luggage, so it takes some pressure off the lower back as well. And if it's like finances, make sure you have that in order from the beginning of the year. If it's for gifts or holiday or entertainment, make sure you have those contingency plans in place. Don't get sidetracked because, oh, December's so far, but look at it now. We were in January like yesterday and now in December.
Yeah. And I suppose the rush would again add to your fight, flight, or fright, like you said, receptors, which is not great for anyone.
The rushing is very stressful. I've seen this. It's not good at all.
Because I think
So
that's when
yes.
people you tend to be rushing and so absent-minded that injuries can occur just by lifting something, I suppose.
Of course, it's the little things, you know.
Finally, Doc, what's one piece of advice you'd give anyone hoping to stay active and pain-free this holiday season?
So I would suggest that people, all of us, all individuals, keep on moving consistently, gently, and often. A few minutes a day can make a huge difference in preventing aches and pains.
If anyone wants to get a hold of you, how can they do that?
So they can WhatsApp me or call me on 068 364 3245. And I'm also on all social media platforms. The name of the practice is called Saisha Chiropractic. It's on Google, Facebook, Instagram, TikTok, and the website is www.saishachiropractic.co.za.
Thank you, Dr. Naransammy, for your insightful advice and for sharing your expertise with our listeners. Of course, your dedication to holistic, evidence-based care and your compassionate approach truly sets you apart in the field. For anyone looking to enjoy a healthier, more comfortable festive season, Dr. Naransammy's guidance is invaluable. To our audience, remember to listen to your body and take Dr. Naransammy's advice, of course, to heart this festive season. Of course, for more expert insights, check out the latest issue of MEDIMAGZA and subscribe to our podcast for future episodes. Thank you so much, Doc. So lovely having you.
Thank you so much, Claire, for hosting me. I really appreciate it. And thank you to the audience and the staff at ZA. I really appreciate it. It was really good to be on this platform today.